This week on the Steele Report.
Our COVID hospitalizations are down 85% since the peak.
Iowa Governor Kim Reynolds on her COVID mitigation strategies and the vaccination rollout, what's ahead for our schools, and much more. And our program begins right now.
Now from KWWL, this is the Steele Report.
Governor, thanks very much for being on the program today. First of all, I know you're very busy and it's early in the morning, but thank you so much. This week, Iowa schools returned to full in-person learning. Yeah. So you and President Biden have something in common there. Yeah. You both feel that our students need to be in the classroom, not online. And there are surveys already out there, research showing that kids who have not been to school in-person learning are already lagging months behind. Yeah. So what damage has been done, do you think, to some of our students who have not been able to be in the classroom?
Well, I'm so fortunate to say that in Iowa, the vast majority of our school districts have been in the classroom since August. School districts across the state figured out a way to do it safely and responsibly, and our data and the science supports that we can do that. But the fact of the matter is, we saw a certain percentage of kids that have not been in school in some of our larger school districts. They're receiving at least one F or D in their grades. We saw where about 20% of our first graders have fallen behind in literacy. Another school district, a larger percentage of their kids, again, were receiving at least one D or F. And so, I mean, we know for a fact that this is not working if you're not in the classroom. Kids are falling behind every day, not only just socially, emotionally, but academically, they're falling behind too. And so I'm hoping by getting the kids back in school, we can start those remediation efforts. We can get them caught up, get them to where they need to be so that they have every opportunity to be successful moving forward.
Now let's turn to the health side of this. 5 Cedar Rapids area superintendents did send you a letter. They were at least asking that if you're going to have it a priority to be in class, that they really feel strongly that the teachers need to be vaccinated. Now, so do you agree with that assessment?
Well, the CDC doesn't support that. Yeah, so, you know, we pick and choose when we want to listen to the CDC guidelines, and they said that that should not be a factor for teachers being back in school. But the matter of fact is they are in the 1B Tier 1 group. Right. And I think if they've, you know, organized and they've got a hold of their public health, they should be working through getting their educators vaccinated. We see many school teachers, educators have already received a vaccine. So, but the fact of the matter is the data just doesn't support it. We're not seeing spread in the classrooms. We have the vast majority of our school districts that have been in since August. They are not seeing the spread in the classroom. It's actually outside of the classroom is where they've seen most of the spread occur. So the data just doesn't support it. We need to put the kids first. We need to get them back in school. We know we can do it safely and responsibly with layered mitigation efforts, and it should be focused on the kids. All you need to do is do a couple listening sessions with students, with parents, with teachers, and administrators. And I tell you, the stories are heartbreaking. What they've seen their children go through, how they've been disengaged, how the curriculum, the rigor of the curriculum is not where it needs to be, 60 minutes, 90 minutes. We need to do better for our kids. And so that was a real motivator for me when I had an opportunity to listen to some of these parents and students that said they're safer in school than they are hanging out at home with their friends.
Right. And now we have the vaccine rollout, a little slower than we anticipated. The weather has been a big factor here recently. So you're anticipating, though, a much larger allotment very quickly coming to Iowa. Yeah,
so next week. And so, you know, it's still, the supply is small. And I just want to encourage Iowans to be patient, but we are getting out what we're receiving. And each week, you know, we have a weekly call with the administration and they kind of give us an update on what the projections look like. And so they've guaranteed we'll get at least what we got this week. And chances are each week it will continue to increase. And next week it's about a 24% increase. So, you know, we're getting more. Johnson & Johnson should be coming online here hopefully by the 1st of March, and that'll also be a real advantage because it's a single dose.
And having the pharmacies involved, that should be a big help, I would think. You know?
Yeah, especially in rural Iowa. So that partnership, and that's outside of what the state gets, and they are going to see their numbers close to double next week as well. So we get just a little under 10,000 right now to distribute to our retail pharmacy partners, and next week that should be double. So that'll help too, and they're really focusing on 65-year-olds and plus, and then that allows our public health departments and some of our other providers, clinics and hospitals, to really focus on maybe educators or some of those other individuals that we're trying to get vaccinated.
Well, I'm in no hurry, but I am waiting on my phone call. But,
Yeah.
The thing about it is, as you look at this, you have these different priorities and everything, different tier groups. Realistically, how long do you think it will take to vaccinate every Iowan who wants to be vaccinated?
Well, it just depends on the supply, and that's just the fact. So right now we have some preliminary numbers. I think it was a little over 500,000 Iowans that are 65 and up. And so you can do the math and see where that takes you moving through, and then they have to get their second dose as well. But I think we thought we'd get through that tier group maybe, early summer. But if we continue to see the numbers ramp up, that could be sooner rather than later. So it's all just depends on where we end up with the number of vaccines that we get from the administration. So we've got a process, we've got preliminary numbers, we can run some of those projections, but sometimes you have to be careful about doing that because I don't want to mislead Iowans. If we get the vaccines, what I can tell Iowans, if we get the vaccines, we'll get it in the arms of Iowans who want to take it.
So criticism runs with the governor's office,
sure.
and this is the defining issue of you being governor of Iowa, and will be for perhaps ever. The new CDC director for the Biden administration, Rochelle Lewinsky, said that she believed that Iowa made a mistake by lifting the restrictions. So have you responded to her about that, or how do you feel about that?
No, because I'm going to base my decisions on Iowa data, and I've been very consistent with Iowans from the beginning, and I think they appreciate that. What we've heard, especially as I was talking about getting our kids back in the classroom, one of the things that parents were so frustrated with was they'd put forward some metrics, and then we would meet those metrics and they would change the rules. So it was a moving target, and so they felt like they were constantly looking for ways to keep them out of the classroom instead of trying to figure out ways to get in. So I've been very measured in the approach that I've taken to, addressing COVID-19, and I think because of that, Iowans have stepped up, and they've done what I've asked them to do.
So your blood must boil when you hear hashtags or hear of hashtags like Kim Reaper.
I have to focus on doing the job. And
I know, I was going to say, I want you to, you're human, so you have to react to that, and maybe talking to your husband, Kevin, they say, well, what are they talking about? What have I done that's so wrong?
No,
what do you say?
You can't take it personal. Well, you can't take it personal. I have a job to do, and I have an incredible team. I'm not doing this on my own. Every single agency has been working around the clock to make sure that they can do everything they can to serve Iowans, to protect their life and livelihoods, and it's both, and to do everything that I can to preserve our healthcare resources. And a huge, huge shout out to our healthcare systems, our hospitals and clinics, who are competitors, but actually came together throughout this pandemic to create one system to meet the needs of Iowans. In the beginning of this, we didn't even know how many vents we had or how many ICU beds that we would have to meet the need, and the numbers were horrific. The early projections, which really a lot of didn't come true at that point, were mind-boggling and scary, and we thought you could, transfer COVID from groceries that you brought at the grocery store. And every day we learned something new about COVID and what we needed to do to mitigate and make our way through it. And so, we've done the best that we could do. I think Iowa's in a really good place because we kept over 80% of our economy open, and our kids have been back in school since August. We are in a really good place to come out of this COVID-19 stronger and better than ever. And you have to remember, I know you know this, but in the midst of all of this, not only did we deal with COVID, we started with flooding on the western and eastern side of the state in 2019. Then we moved into COVID, and then we moved into civil unrest, and then we, had a little thing called the derecho that hit the state of Iowa, as well as over 90% of our counties have been impacted by a drought. So it's been a heck of a year, but what I know about Iowans is they're resilient, determined, and we're going to come out stronger than ever.
We will continue our interview with Iowa Governor Kim Reynolds in just a moment. Welcome back to the Steele Report for this week. As our guest is Iowa Governor Kim Reynolds, let's continue our discussion right now. as we speak today, it's 5,300 deaths.
One death is one too many.
That is 17 years of Iowa traffic deaths that average about 300 a year, all in less, and we're not even to the 1-year anniversary yet.
Yeah, one death is one too many. And that's, that goes without saying. That goes without saying. We have an elderly population. The sad thing about this pandemic and this disease is it impacts elderly Iowans more than it does our younger population unless they have underlying conditions. So, every governor is grappling with that or experiencing some of the same statistics, but one death is one too many, and we tried to do everything that we could. My whole team did, and Iowans did, to try to mitigate and manage the virus. So, we will continue to do that moving forward until we have Iowans vaccinated and we move on.
At least you're not Andrew Cuomo right now. He's a perfect example of what happens or what can happen if you are not totally transparent with your constituency, the residents of our state. When you think about this, what kind of toll do you think it's taken on you personally? You've had to have taken a lot of this stuff personally. I mean, I know you're talking about the team effort and everything, but it all falls on you. You're the governor of Iowa. It all comes back to you.
That's part of being a leadership. I mean, that's part of being a
I
governor.
know you don't want to show any weakness or any hesitation. I understand.
Well, I don't have the luxury of doing that. We've been, my team's been working 7 days a week for a year. And you step up and you do what you need to do, and you use the expertise and the team and the leaders that you've surrounded yourself with, and you make the best possible decision that you can with the data that you have at the moment. It's very easy to look back and say, I should have, I could have, we should have, but you have to remember that, information was changing daily, and it still is, really. I think I just saw something about Pfizer this morning that says it doesn't have to be kept in the low, temperatures that they say that it needed, and one dose may be enough. So, I mean, it is a moving target. And so you just have to do the best you can with the information that you provided. And I do think, overall, we're going to come out of this okay, stronger. We're in a good position. I mean, several of our surrounding states are raising taxes because, they've had their state locked down. And I don't know what they're going to see with the kids that haven't been in school for a year. And then you've got, some of these school districts in some of these states saying, it might be next year before they get in. That's unconscionable, what we are doing to these kids, unconscionable. And the parents, it's taking women out of the workforce. I talked to a mom that said, I feel like I failed at everything. I'm failing at being a mom, I'm failing at being a wife, an employee, because she's trying to work from home while she's trying to educate her children. I'm not an educator, my daughter is, but my other two are very clear that that's not the path that they decided to go in. And so, that's kind of what everybody is dealing with. And so it's time that we figure out how to do it right. We did, but it's in the best interest.
You just showed me that it is personal to you. You just talked about this, and this means a lot to you, doing the right thing. There is data missing, though, of minorities, Hispanics, African Americans. Can you promise Iowans you'll really try to work as hard as you can to make sure they know what they're up against? Because obviously some of the statistics show that
those are the most impacted.
Exactly.
And if you look in the school districts that have been shut down for a year, those are the kids that are being left behind. Yes, I'm passionate about this. This is our greatest asset. These are our children. And it's unconscionable what's happening to them, especially when we know we can do it safely and responsibly. So, I'm passionate about a lot of things, but I've been passionate about education from the very beginning. That's why I love STEM and why I love work-based learning and why I love bringing CTE back into the classrooms, because those are the kids that benefit the most.
So you announced the first 3 cases of COVID back on March 8th.
Yeah.
Exactly. Think about this. What regrets, if any, do you have? Is there something you said to yourself, I wish I'd have done this, I wish I'd have done that, maybe I made a mistake? Can you think of something like that?
Oh yeah, every day, because the data that we receive and the information that we receive changes. So honestly, one of them at the time, I probably would not have shut schools down, even when I did. If I'd known then what I know now, I wouldn't have done that, but we didn't. At that point, community spread was 3 to 4 cases in a county, and every state across the country ended up shutting schools. And I bet most governors would, a lot of the ones that I work with would tell you that they probably would not have done that if they knew now what we, if they knew then what we know now. So that would be something I would change.
And you're under a lot of pressure to shut the entire state down. Tell me a story of a business person who has a lot to lose, who has talked to you and said, listen, this is going to put me in bankruptcy.
Well, listen, I've started doing 99 county tours again. We have reached out to businesses throughout this, even trying to put together the CARES funding so we could do some stopgap financing for these individuals. I mean, that's what the emotional toll and the mental health. I talked to the press conference the other day about what was on the rise and what was actually going down. It is mental health. People saw their lives and their livelihoods just be destroyed. I mean, something that they put all of their financing and time and effort into, going away. So I have had business after business after business thank me for being reasonable and responsible in moving through this and giving them the opportunity to put in the mitigation efforts to make sure that they could keep their customers safe. They know what they're doing and they're willing to do it. Just, thank you for giving us the opportunity to innovate and stay open. I was in Davenport last week in the Quad Cities, and there was a business that expanded through COVID-19, opened 2 new stores, and it was because they went online and they did innovative things, and they're optimistic about their future.
Which criticism do you think is the most unfounded of that you've
I
received?
Can't even listen.
There's so many.
Yeah. I mean, I can't. You can't make decisions on that. Mm-hmm. I have to look at the data. I've tried to use data in all of my decisions, and hospitalizations has been a prime piece of that. Mm-hmm. Community spread. We meet every day, multiple times throughout the day, and I'm checking. I start the day, in the morning. I look at the data. I'll go on Domo. We've got a daily report that I get. We have a briefing. And I usually end my evening taking a look at where we're at, taking a look at where other states are at throughout the country to get some sense of, and the map looks really good right now compared to what it did in November, where it was solid red, and it actually is everything is moving in the right direction, and that's across the country. So, I have to continue to take a look at the data, continue to work with the team, and continue to move forward with this in the best way that we can. And I think, there's, hope. There's light at the end of the tunnel.
You have an interesting statistic to share with Iowans about the number of people vaccinated already, even though, there's been a lot of criticism that it's going too slow and can't get the vaccine, but the stat is what?
Well, our number, or just the allotment that we get is really low, but here's some good news. Mm-hmm. Over 250,000 more Iowans now have been vaccinated than have tested positive for COVID-19. So we're moving in the right direction. And part of the slow rollout with the vaccine was tied to our long-term care facilities, and we had no say in that. And we have a large number of long-term care facilities in the state of Iowa. We've actually vaccinated more long-term care residents than Minnesota, and they have twice the population that we do. So, when you look at it from a per capita basis, we're in the top 5 states for nursing home facilities in the state of Iowa. And that was done by the 2 pharmacies. That was the partnership through the federal government, and we just had no control over that, and it's just taken way longer than it could. And I can tell you every other state in the country, every other governor is very frustrated with that. But we're almost there. So, by the end of February, we'll be there, and that'll be done, and that'll be a good feeling.
We need to take one more break here on the Steele Report for this week. We're coming back to talk more with Iowa Governor Kim Reynolds in just a moment. And welcome back once again for this week's edition of the Steele Report with Iowa Governor Kim Reynolds. Let's continue our interview right now. I would like to ask you, though, do you think the pandemic for Iowa was worse than you first anticipated when you first started talking?
Every day we learned and we tried to adjust and adapt, and we'll see. We're not through it. So I think, there's going to be time, Ron, to really look back and take a look at that and what other states have done. And what Iowa has done, and all of that will happen without a doubt. And so when we get through this, we'll have an opportunity to, we're already reviewing. That's part of the process, when we make changes and adjustments to the things that we've put in place throughout the pandemic. It's hard to believe it's almost been a year. And then sometimes it feels like many years.
10 years,
in the last year.
So the legislature has given you almost what you wanted for school funding. It is nice to have the education funding at least set in stone early in the legislative session. And 2.4 is a little short of what you wanted, but are you okay with that?
Yeah, and we made a commitment when we took back both chambers and the governor's office that wasn't going to be a political football, that we waited till the end of the year because it's not fair to them making budget decisions, and so we tried to get that done in 30 days. I asked for 2.5, but so that's really close. And then in addition to that, you know, they're doing per pupil and transportation equity as well, and then they're working on some other components. So I think overall, I think it's maybe even a little bit more. So I'm happy with where they've landed.
Yeah, I know, like in my community of Hudson, Superintendent Tony Voss said that their enrollment was down a little bit because of the pandemic, and a lot of schools have seen that, right?
Yep. I think it's mostly like in your preschool and your younger grades, because I think people, you know, if they're not going to be in the classroom and they just decided to wait a year instead of trying to do that from home. So I think that had a lot to do with that.
One of the most frustrating things for Iowans driving through a rural county is they'll be on their phone, but all of a sudden their internet service is gone. So this broadband initiative, that seems to be a very high priority for you.
It is a really high priority to me. That's one of the things I think we've learned from 2020 and from the pandemic and the derecho. First of all, Iowa's not near where it should be as far as connectivity. I appreciate the Economic Recovery Advisory Board. That was their #2 priority that they recommended, and really put together a lot of research and facts. When you think a third of our counties are broadband deserts, we have only 18% of Iowans have access to affordable internet, and the national average is around 50%. We're 45th in terms of access, and we have the second slowest speed in the country. We're just right under Alaska, and that is not anywhere where we need to be. When you think about the importance of being connected and being competitive and being able to work from home, telehealth, teleeducation across the board, and we need to bring parity to all of Iowa. And so my proposal is $450 million over 3 years that will leverage millions of dollars in private sector funding. And if we get this done, Iowa will have the biggest broadband build out in the country. And we'll go from the 45th to the top of the pack. And we will say to business and industry and people across this country, Iowa is the place where you want to do business.
It's probably a little early to talk about this, but I assume it's a foregone conclusion that you're going to run for re-election. Is that the case?
Well, I haven't really thought about it much because it's been a busy year, but I'm so honored to be serving Iowans as the governor of this great state. I'm so proud of Iowans and just how they have responded to every disaster that we've faced. And it's who we are, it's what we do, and it's just so encouraging to see that at every turn, and I have seen that at every turn. So there's a lot of things I'm still working on that I haven't finished, and so it's hard to get that done in 4 years. So, you know, I look forward to announcing what we're going to do
well, we'll just take that as a
soon
yes.
Here. But I love what I'm doing. I'm very blessed, and like I said, there's a lot of things I haven't finished.
So would you be comfortable with Donald Trump coming back as the candidate for the Republican Party in 4 years? You were pretty close to him, or is it time for the GOP to move on?
Well, I think that'll shake out. I appreciate the policies. Like, we mirrored a lot of the policies that he put in place. You know, this was just the largest economic recovery, I think, in my lifetime. Unemployment, lowest that it's ever been, especially for African Americans and for Hispanics and for women. The largest tax cut that we've seen in the history of the country, and we also were able to implement that in the state of Iowa. So, you know, I appreciate the policies, the pro-growth policies that were put in place. I am passionate about workforce. That was a priority. I got to participate in the President's Workforce Advisory Policy Board. I appreciated bringing to the table what we're doing in Iowa, and I got to share that with the country. And that's also a great advantage when we're trying to bring business and industry into the state of Iowa. So, you know, I think we're on the right path. I appreciate the policies, and we'll just see. I think you're going to see Republican-led states across this country. When you look at the economic measures and metrics, we're going to come out of this pandemic stronger and better than ever, and you're going to see that not only in Iowa, but in other states that are led by Republican governors.
What's your immediate goal here in the next few weeks, a few months, as this pandemic continues to kind of linger on, but with some signs of, encouragement? Yeah.
Oh yeah, well, we're going to continue to just the vaccine rollout. We want to make sure that we're prepared for when we do get additional vaccines. So we're working on that. We're working on standing up a new website. We'll be announcing that next week. So we're constantly looking at processes and our partners and what that looks like moving forward. Mass vaccination clinics in different areas of the state. So that continues to be one of our #1 priorities right now. And then just working with the legislature, because the policies that I'm working on, I believe, are bold, innovative, and foundational for us to really come out of this stronger and better than ever. And so we're going to continue to work with our legislators and see if we can't get through some of the priorities that we laid out at the beginning of the session.
So thanks to Iowa Governor Kim Reynolds for taking the time to be on this week's program. A reminder, all of our shows are on the kwwl.com homepage. Just go to the Watch tab, scroll on down there to the Steele Report, and there you'll see all of our recent programs. That's it for this week. Thanks for watching. We'll see you next week on the Steele Report.